Hello guys, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I would like to cover a very controversial subject: are medical fields getting saturated in India and what is the future? So I have done a detailed video about MBBS saturated in my channel. You can go through that, where I explain the math behind how many doctors are required, what is the demand supply and all that. But after analyzing and reanalyzing again, I changed my mind now. I'm going to tell you another version, another perspective to that. Okay. This perspective is built not on the numbers, it is mainly built from the real time stories of people who called me. Okay. So the first story is about a pulmonologist who finished his MD in pulmonology and is struggling to get a job in a big tier 1 city like Chennai. He went to multiple hospitals and they are not giving him a pulmonologist job. And then he had to, but what they're saying is there are vacancies in intensive care if he's really interested in doing night duties or covering some shifts. But he's not interested in doing. He wants to stick on to his core specialty, pulmonology. So he called me one day and he asked me what to do. Okay, actually I was gone into a kind of a mind block. I couldn't answer his question that time, but later on I gave some solution to him. That is a secondary thing. The second story is I called my friends who are working in tier 4 and tier 5 cities or towns in India, and what they're saying is even if 2-3 specialists come to that particular area, it gets saturated. Okay, I mean patients, a lot of competition is building up in that particular area. This is another story. This is also a real-time story. And the next story is the anesthesiology colleagues of mine and so many other people who, anesthesiology, there is no problem in getting their job. But what they complain is, they are complaining that it is very difficult to become a consultant in bigger hospitals, or it's getting very difficult to get promoted because the top tier of people are all saturated. So if you think about saturation, you have to think about getting promoted also, right? How saturation affects the medical system is not getting the job, getting promoted also will become difficult. And these are the different real-time stories which led me to a conclusion that there are some signs of potential saturation in our country, which is going to happen in near future based on these stories. Four aspects or indirect signs of saturation are: if there is a difficulty in securing a job in the desired specialty, okay, what happened to the pulmonologist, then you can assume that that particular area is getting saturated. Oversupply of specialists into certain areas. For example, one area will have a lot of neurosurgeons, so that particular area is saturated in that particular specialty. And lack of promotion opportunities to senior levels. For example, the anesthesiology story, if you take, they are getting the job, no doubt in that. But getting promoted is the key in life, right? You have to grow in life. If that is not happening, then again you have to consider that some saturation is happening in that particular area. And smaller towns also, people think that if they go little lower in the tires, they can easily click. But the problem there is few people will saturate of that particular specialty. So even if you're a beginner and if you started there, 2-3 people more will come into that area and they'll saturate off. So all these indirect signs are showing that India might go into a level of saturation in future. There is no doubt in that. Even the WHO and Indian government says that we need more doctors, but these are the real-time stories. This is not built on the numbers. This video is all about the emotion and real-time stories. So the next thing is, so if you ask me then, Dheeraj, why are you doing this particular video? We all know that there is a saturation happening in this country. The reason I am doing this video is I am proposing a strategy to you to have a very good balanced life and also beat this competition. Saturation is not the right term is competition. So what is building now is competition. So previously it was easy to click because competition was less, but now population increased, right? Competition is increased. So indirectly we call it saturation, but it is actually competition. So then to beat competition, and then there are different ways to do that. You can dedicate your life totally and you can compromise your family life and beat it. Totally agree. Even though it is difficult to do, that is one way. The other way is to have a balanced life and then beat the competition. That is what I am going to tell you in this particular video. So how to do that? There is a strategy. Without strategy, if you just blindly put hard work, what happens is, you can see in the first image, you are actually not focusing there. With a strategy, your efforts will be focused. and then the chances of beating the competition is very, very, very high. Okay, so there are 5 steps to that. The step 1 is after you finish your post graduation, what you actually need to do is you should not find a job which gives you more money. According to me, you should find a job under a mentor, and you should join apprenticeship under him for 0 to 5 years. And that particular mentor should either be your role model, what you really want to become, or he should actually have some kind of skills which will help you in reaching your end result. Okay, for example, if you want to go to USA in future, if you want to go to Middle East, if you want to go to Australia, you have to do publications, audits and other things, right? So that particular person in India should have the skills or should have the infrastructure to help you in doing those things. So there you have to invest significant time. You have to do at least 5 to 8 publications, and you should be the primary author in that. Okay, and then do some quality of projects and do some presentations and build your CV in that particular area. So that is the first step you need to do to beat the competition. Okay, so this is common for any specialty, clinical and non-clinical. But the core clinical specialties will come towards the strategy. 4 and 5 points are for them. Okay, this is common for any specialty, from anatomy to topmost super specialties like neurosurgery. So once you finish your 0 to 5 years and if you feel that you have built a decent CV, then you will enter step 2. Step 2 is building a personal brand. Building a personal brand is platforms like LinkedIn are there, very professional platforms. You all have CVs, I think so. And there you have to project your work, your presentations, your publications, and the administrative roles that you're taking in your hospital, like committees and everything. All those things should go into LinkedIn. So if somebody searches that, it should feel like you are a leader. Okay, it is no longer you should think that you are a follower. You have to work like a leader. You have to think about innovation, research. So that kind of image you need to project to the world in LinkedIn. So that is personal branding, and you have to brand yourself in your area. And I personally recommend to brand in a niche area. For example, if you're an anesthesiologist, go to one area like quality, or go to another area like education, or go to another area of regional block, or somewhere you try to brand yourself in only one area. It gives clarity to the people who is going to hire you, so that they can hire you for a specific skill that you have. Your life also will be easy. Their job also will become easy. So that is called as personal branding. It will be done on LinkedIn. If you can't do, there are so many agencies who do for you. So you can do that. If you can approach the agencies who help you to build a personal brand in the social media. They'll charge some money, and I think you can invest on that, because investing on yourself is the best investment. So this phase will go up to 7 years according to me after your post graduation. So then what to do, Dr. Dheeraj? Then the next step is, I recommend everyone to have an international exposure. So either you plan settling there, or you have some 3 to 5 years of experience in some good country and come back. One of that you decide. In the order: USA, UK, Canada, Australia, Middle East. Okay. In Middle East, UAE countries like Dubai, Abu Dhabi are better. So these countries you have to plan. So if you have crossed through my 2 steps, this third step will become dead easy, because your CV is built, your experience is built, you are like ready-made product for all those guys. You apply, you will have a high chances of beating the competition there. And then there will be ECFMG certification process. There will be some kind of a agency you have to approach if you're planning to go to Middle East, or you have to go through USMLE examinations and steps for USA. And then you have to go through specialist pathway for Australia, and Canada will have, you have to go through fellowships for Canada. Every area will have the specific things. I've done a lot of videos in my channel. You can go through all that. Go there, be there for 3 to 5 years, and then think about what to do. Either settle there or come back to India. Either ways, your job, you will have a very good future, because either you come back to India, you have a good international exposure, your soft skills would be good, and that is what India also wants. Okay, that is a step 3. So now step 4 is, this is for core specialties only. For example, if you are an anesthesiologist, pathologist, or service sector, till step 3 if you do, that is enough according to me. Step 4 is for core specialties like cardiology, neurosurgery, general medicine, family medicine, all those guys. For after step 3, once you come back from a different country, then you set up your clinic, and then you see the kind of advantage that you have. So a person who actually set up his OPD from beginning will have a patient base, no doubt in that. 2-3 years it will take. But now, since you have an international exposure, since you have publications, you have a profile, your image is different. When you come back to India and then you approach a hospital, you will not get a job. You don't be surprised because they're already established guys, right? So you don't get a job. Then you have to set up your OPD, build your practice. Again, 2 to 3 years it will take. Okay, and sometimes 4 to 5 years it would take, and then you'll build your own practice, and you have the the tip of the iceberg you have to develop now, since the base of the mountain is already developed. So it will be very easy to develop tip of the mountain. Again, here some don't click, some will click. Again, it depends upon how you actually talk to people. Your soft skills will matter. I have seen people who clicked in this phase who didn't click also, and struggling even after coming back from UK and India. I've seen many surgeons actually are struggling. I've gone through those stories also, but there are a good number of stories who clicked after coming back. Like, the Rela Institute is there. Muhammad Rela is there. So he is a UK written person, and now he has set up Rela Institute. He does transplants. He is a UK written person. Like that, there are many stories who came back and who clicked. Okay, look at those stories. Don't look at people who didn't click. Okay, that is the best way of doing. Then this is step 4. And step 5 is the entrepreneurial path. So entrepreneurial path is more like after 10 plus years of experience, and you came back from a different country and you set up your OPD and it has become click. Now you have a patient base. Now you can think about having a franchise model of your hospital, or you can invest in a big hospital and you can construct a hospital in a tier 2 city or in a tier 1 city in a location where competition is less. Again, don't construct beside a big hospital. It will be a problem. And I have seen some of the hospitals which are located near the government hospitals and big hospitals like Narayan Hrudayalaya and all that. They are also clicking because patients would come there, right? If they're not getting dates in those hospitals, some spillover happens and they might actually come to your hospital. Even that strategy might work out. So those stories also I have. So this is the 5-step process I think you should follow to beat the competition, because everybody, if they do the same thing, then it is very difficult. You need to actually do something different like this and you can beat the competition. If you are following the 5-step model which I am telling, how many number of doctors Indian government is giving permission to a lot of hospitals, how many of doctors come, you can beat the competition, beat the saturation. Okay, I will give guarantee for that. So there are success stories also. So like 3 different stories I will tell you. Dr. Neha is there. She is endocrinologist. She started her practice after endocrinology and she's well published. She started her practice in Mumbai. She's clicked, and a lot of patients are coming, because before starting she was thinking that whether the practice will click or not, but it actually clicked because there's so many people suffering with diabetes. And then you might think that everybody does diabetes treatment, but if an uncontrolled case, if you take up as a challenge and then you control diabetes, that one person will get you 100 more patients in his vicinity. That is how you have to take up. It will grow slow, I know, but if you put your effort, if you take it as a challenge, and if you are updated and if you have the persona, you will click. Okay, even with this kind of saturation. Okay, and Dr. Sushma is another young surgeon who started her practice in a tier 3 city. With Ayushman Bharat scheme, she operated a lot of cases, and then the cases whom she operated got more patients and her practice clicked. Like that also you can click in a tier 3 city. Okay, so these are the different stories. So all these stories, I know this presentation might raise some concerns in you about saturation, because till now I never spoke about saturation, but still at the same time, if you follow my strategy, you will click and beat the competition. So there is saturation happening, no doubt in that. I don't deny it, because obviously that is the evolution. In evolution, what happens is the number of people, when they increase, competition will increase. Saturation will happen in every area, but there is always a way to differentiate yourselves from that. That is what I told in this video. If you like this video, then I hope you subscribe to the channel and then share this particular video to many people. It will help in growing the channel. So thank you very much, guys. Also, I'm doing a video on best DNB colleges in South India, which is going to come. I'm planning to do it as a live session. Either I'll do it as a live session or I'll do it for my people who joined in my channel separately. I'll answer the questions directly there. So just subscribe and stay in the channel. You get all the best information that I'm collecting from the people. Hope to see you guys in the next video. Thank you very much.